Hi. Many of us as a patients will be having many doubts. Suppose one person is a weight so much kg. Really whether I am indicated for a medical management or whether I have to go to balloon therapy or liposuction or I have to go to bariatric surgery. I can I reduce by only diet and exercise. So these questions will be there when you go and approach in a different center. The different answers will be there. Suppose in online aggregators, suppose you go with somewhere the weight loss. There are so many weight loss aesthetic clinics will be available. They will tell you undergo this. We give some injection. We give the diet therapy. We give you assurance, and there will be 100% weight loss. But when you and otherwise money also returned back will be returned back. Many of patients have come to us with this false assurance when they have to sign some almost 20-30 documents. Many clauses will be there that they won't see and they'll sign. But when they won't lose the weight and when they ask for a return, they won't pay you back because there is clauses. And many of them go to consumer court, they fought it back and they claimed it also. That we have evidence. So the normal body mass index first is 18.5 to 24.9. That means weight in kg divided by weight in kg divided by meter squared. That is that we should be around 18.24.9. That is the normal body index basal but that can change. That is not going to give you whether you have a body fat, more of muscle mass. Suppose you are doing a regular exercise, your muscle mass will be higher, even though it might look overweight or obese, but it may be normal. Fat will be lesser. But some people who do only dieting, then muscle also will go down and fat also will go down. Then it can give false perception, the false weight, reduction in weight, all this can be taken. That's why always you have to undergo body mass analysis. Most of the good gym center and some few good hospital, that body mass analysis available. Please undergo that, and then only the segmental wise muscle fat in each limbs, upper abdomen, lower abdomen, what is the visceral fat, what is the total body water, what is the skeletal muscle mass, what is the bone mass, all this you can come to know by in body mass analysis. Body mass analysis that you need to please undergo in a good center. Next we will come to the if the BMI is 18.2 to 24.9, it is fine. You just do diet and exercise. If the BMI is 18.25 to 30, that we call overweight. In this section, first thing is what you have to do diet and exercise that you need to do. And don't say that you don't have time. You have to give some time for your exercise. And if the BMI is more than 30, we call it obesity. Then 30 to 35 class 1, 35 to 40 class 2, more than 40 is class 3, then super obese. If the BMI is more than 30, that is controversial. Then what treatment you have to do? If the 25 to 30 BMI, you can do diet and exercise. And if still not helpful, you can go to medical management, some recent many injections, semaglutide, tirzepatide, all these injections I have got. It will work well, but you should know that there is a limitation. These medications you cannot take lifelong. Under supervision only you have to take. There are many side effects are there. Please know there are retinopathy, pancreatitis, if those are thyroid issue they should not take, and so on. So before taking, you should know the proper indication. Next, you can undergo for 25 to 30 even the medicine, liposuction or balloon therapy. Yes, it can be tried. Or balloon therapy is a temporary. You have to change some Alluvian balloon after 4 months you have to change. Some balloon 1 to 2 years afterwards, like spars, obera, you need to change 1 to 2 years every month. And remember, this is a temporary. Once the balloon is removed, the weight regain do happens. Maximum weight loss by balloon or by injection is around 15%, 5 to 15%. Even though company says up to 20%. So that is the cost effectiveness, side effects, all this you have to see. Balloon, you might think in advertisement just you keep the balloon, remove, coming to the clinic. That is not true. Patients who have undergone, they will know the reality. Many issues like gastritis, many people have removed within 3-4 days after keeping the balloon because severe side effects. Those who have acute gastritis, balloon should not be placed. And those who have gastric issue, chronic issue, balloon should not be placed. Please remember it. If you call online aggregators, they will insist you to undergo balloon. Remember, balloon is not the solution and you should be very, very careful. So always we should be careful when you undergo to balloon. Don't listen to the aggregator. Be pros and consequences, please know that. It's very, very dangerous if you have some side effects or if you have acute gastritis, and if it is not placed in proper position and it is not a permanent solution, you need to keep every frequency after every 6 months, some balloons up to 1 to 2 years, it has to be changed. It is not a permanent solution. That you should keep in mind. If the BMI is more than 30, then other things are comes. Like you can balloon, yes, with a doubtful, because once the BMI increases, chance of failure will be higher. BMI, IRDA guidelines have clearly shown that if the BMI is more than 35, they have either one of the comorbidities, diabetes, hypertension, or cardiac disease, or sleep apnea, then that are the indicated if the BMI is more than 30. And that will be covered by health insurance also. This American Obesity Association recommendation also. If the BMI is more than 40 without any disease, they are indicated and it is covered by health insurance, including all the private health insurance, most of the central government, CGHS, ESI, PORT, and so on. So if the BMI is more than 40, there is no other treatment is indicated. If the BMI is more than 35 with comorbidity, it's better they should undergo bariatric surgery. It's because it's a metabolic surgery. Or whatever liposuction and balloon and other medications are all temporary, and the weight loss is only maximum 10 to 15%. Whereas in the bariatric surgery, weight loss of excess of body fat is almost 80 to 90% excess of body fat will be lost. So please visit the doctor who is specialist in that and get a proper consultation and decide your unfit. So like that, so you have to choose, apart from the good luxury rooms, you have to see whether the hospital is equipped with modern equipment, is up to date, whether surgeon is qualified, how many surgeries he has done, how much you need to see his reviews, not the Google review and other things, genuine reviews. Patient, you need to interact with the patient, and also you have to inquire regarding the infrastructure, which will be, because most of you miss what is the anesthesia. The most important aspect is in the operation theatre. Whether that is where you will be anesthesia, you will be unconscious. So those things you will miss that. So I request you to please give importance to those things. It's always better for all this have been chosen by a good doctor. That's why it's very important. You need to. So there are many things are there when you go to the online aggregator. You will see the free delivery, cab, and these things. Many of patients they will give importance to that. So ultimately they will be taken into a smaller hospital with no basic infrastructure. That's why it's always you have to go interact with the doctor personally. Don't go with the online aggregators. Please go and visit the doctor, discuss with him, and he is the one who is going to ensure you good proper treatment. I'm Dr. Mitra, consultant bariatric surgeon. If you have any queries regarding the surgery or any surgery or advanced surgery, please contact me. Thank you.